Bonjour, bienvenue à cette conférence de presse. Hi, my name is Guillaume Saint-Pierre and I will be your moderator. With us today, Jean-Yves Duclos, ministre de la Santé, Monsieur Omar Alghabra, ministre des Transports, René Boissonnault, ministre du Tourisme. Donc, on va commencer avec des déclarations de chacun des ministres et ensuite, on va prendre des questions selon la formule habituelle. So, Monsieur Duclos will be first. Allez-y, Monsieur Duclos.
Merci, Monsieur Saint-Pierre. Merci, Guillaume. Et bonjour à tous et à toutes.
Good morning to everyone.
Today, I am joined by Minister Alghabra and Minister Boissonnault, as well as Dr. New, who is joining us also virtually. Aujourd'hui, je suis accompagné par le ministre
Today, I'm accompanied by Minister Alghabra and Minister Boissonnault, as well as Dr. New. They are all joining us virtually. Last week, on March 11th, we marked the second anniversary of the pandemic. It was a day to mourn those who have died from COVID-19, 37,000 people, to recognize those who have contracted the disease and those who continue to suffer its effects. And the fact that they're continuing to suffer its effects. It was also a day to recognize and to thank the healthcare workers who have sacrificed so much and who have spent the last 2 years on the front lines to protect us. After 2 years of following individual public health measures, people in Canada know what to do to keep themselves and each other safe. As I've already mentioned in the past, we are in a much better position today than in 2020. High vaccination rates and strong adherence to public health measures have pushed us through the peak of the Omicron wave. We have more tools, like widely available rapid tests, and a range of new treatments that can help some patients from getting seriously ill. We can now say that we are in a transition phase. And further to our February announcement, we can now announce other changes at the border. Starting April 1st, 2022, fully vaccinated people will no longer have to be required to complete a pre-entry test for travel to Canada. As fully vaccinated travelers may still be selected to undergo random testing upon entry to Canada, but they will no longer be required to quarantine while awaiting their results. Unvaccinated and partially vaccinated travelers will continue to be tested with COVID-19 molecular tests on arrival and on day 8, while they quarantine for 14 days. All travelers are also required to complete ArriveCAN online or through the free mobile app before entry to Canada. Today's announcement is encouraging, but I will remind you, all measures are subject to review. We will continue to adjust them as the epidemiological situation evolves. I want to thank everyone in Canada for doing their part, getting vaccinated, and for many of you, for getting boosted. And you have followed border measures if you choose to travel, and you followed local public health advice. Your cooperation is helping the country transition to the next phase of the pandemic. Living with COVID-19 means that we will continue to exercise that power and make prudent, smart choices for our communities and ourselves.
Last week, on March the 11th, we marked the second anniversary of the pandemic. That was a day to mourn those who have died from COVID-19 and to recognize those who have contracted the disease, as well as those who continue to suffer its effects. It was also a day to recognize and thank the healthcare workers who have sacrificed so much over the last 2 years and spent that time on the front lines to protect all of us. After 2 years of following individual public health measures, Canadians know what to do to keep themselves and each other safe. As I've mentioned in the past, we are in a much better position now in March 2022 than we were in March 2020. High vaccination rates and strong adherence to public health measures have pushed us through the peak of the Omicron wave. We have more tools available now, like the wide availability of rapid tests and a range of new treatments that can help keep some patients from getting seriously ill. I think it's fair to say that we are now entering into a transition phase of this pandemic. As the weather warms and people spend more time outside, we can expect to see transmission decline in the coming months. But we have to be prepared for a waning of collective and individual immunity. Of course, the government of Canada will also keep monitoring for new variants through our robust surveillance system and adjust public health measures as necessary. In the meantime, and to build on our last announcement in February, we are now ready to announce further changes to border measures. Effective April 1st, 2022, fully vaccinated travelers will no longer be required to complete a pre-entry test for travel to Canada. Fully vaccinated travelers may still continue to undergo random testing upon entry to Canada, but they are no longer required to quarantine while awaiting their results. Unvaccinated and partially vaccinated travelers will continue to be tested with COVID-19 molecular tests on arrival and on day 8 while they quarantine for 14 days. All travelers are also required to complete ArriveCan online or through the free mobile app before entry to Canada. Today's announcement is encouraging, but let us remember that all measures are subject to review. We will continue to adjust them as the epidemiological situation here in Canada and abroad evolves. Finally, I would like to thank Canadians for doing their part, getting vaccinated, and for many of you, getting boosted and following public health advice. We have the power, individually and collectively, to reduce the impact of the virus on our lives. Living with COVID-19 means that we want to continue to exercise that power and make prudent, smart choices for ourselves and for those we love. Thank you, and I will now turn it over to Minister Alghabra.
Merci, Jean-Yves. Bonjour à tous.
Thank you, Jean-Yves, and good morning to everyone.
I want to begin by acknowledging that I'm joining you today from the traditional territory of the Mississaugas of the Credit First Nation. Today is a day that many of us have been waiting for. It is a great day for Canadian travelers, tourism, and aviation. Ce sont des bonnes nouvelles.
This is good news.
We've said all along that we would adjust our border measures based on public health recommendations. And that is exactly what we are doing today. I also want to highlight what removing pre-entry testing will mean for cruise ship travelers when the season starts in early April. Passengers on a cruise will need to take an antigen test no more than 1 day before the scheduled departure, but will no longer be required to be tested before getting off the cruise ship. All other aspects of the public health framework for cruises that I announced last week in Halifax, such as the requirement to be vaccinated in order to board, will remain in place. As Minister Duclos noted, the revised border measures we're announcing today are possible thanks to the millions of Canadians who have stepped up, rolled up their sleeves, and gotten vaccinated. Merci à vous tous. I want to assure you that the health and safety of Canadians remains a priority, and we will still have the necessary safety measures in place for travelers. La santé et la sécurité des Canadiens sont une priorité.
The safety of Canadians are our priority.
For example, our government is investing in Canada's airports to support testing and screening for COVID-19 to make the travel experience as safe and as convenient as possible. And just last Monday, I announced a major investment at Pearson Airport, and more announcements are coming. We also continue to have measures such as the obligation to be vaccinated to take a plane or a train in Canada and wearing a mask in Canadian airports and on planes. But as we've always said, public health measures are temporary, and we will adjust them based on public health recommendations. And as we move to this next step, I want to thank our airlines, airports, tourism operators, travelers, and all workers in the air sector and cruise industry for their tireless work over the past 2 years. It has not been easy, but all of them have stepped up. And now I would like to turn it over to my colleague, Minister Boissonnault. Thank you very much. Merci.
Well, thank you very much, Minister Alghabra, Ministre Duclos, Dr. Arnoux. Quel plaisir d'être ici avec vous.
What a pleasure to be with you here today for this big announcement.
My colleagues, I want to acknowledge that today I'm joining you from Calgary and from the lands of Treaty 7 peoples, the territorial lands of people who make Treaty 7 their home. There's no denying that the tourism sector has been uniquely affected throughout the pandemic. And as many of you know, in the past few months, I've heard from and met so many inspiring entrepreneurs, organizations, and businesses in Canada's tourism sector who worked hard to keep their operations afloat, to reinvent themselves, and to continue to find creative ways to get through this global pandemic. And since becoming Minister of Tourism, I've heard their concerns. I've also seen resilience and an innovative spirit that has been inspiring for all of us. I can't help but thinking of tourism entrepreneurs like Tina Dixon from Whitehorse, who told me recently that she just wanted to get back to work. It's been way too long of a break. To Tina and all the incredible people who make up our sector, you should all be proud of what you've managed to accomplish during these difficult times. And today's announcement has been eagerly anticipated by Canada's tourism industry. My friends, the time has finally come. Today, we announced the lifting of testing requirements for fully vaccinated travelers. Canada's tourism sector is ready to ensure the safety of travelers, employers, and the communities in which they operate. They are ready to welcome back the world. As you know, the government of Canada is deeply invested in seeing our sector, the tourism sector, thrive once again. Budget 2021 introduced a 3-year, $1 billion commitment to the sector. We have had your backs, committing more than $15 billion in total support to the tourism, arts, and culture sectors through this pandemic. And this includes the $500 million Tourism Relief Fund, which was created to help tourism businesses and operators adapt to our new reality while setting the stage for future growth. Since December, we've rolled out an additional $12 billion in support. We did this because we know that the Canadian economy will not fully recover until our tourism sector recovers too. And that recovery is now at hand. With the reduction in travel restrictions announced today, notably removing the requirement for fully vaccinated travelers to submit a pre-entry COVID-19 test result, we are making it easier for people from around the world to visit Canada this spring and beyond. And they will come. With our high vaccination rates and our focus on health and safety, Canada has a huge advantage in attracting visitors because they know it's safe to travel to Canada. We know the best way to overcome the extraordinary challenges of the last 2 years is by coming together in a spirit of partnership and collaboration across all levels of government and with the sector. We know that
the best way to overcome the obstacles of the last 2 years is to work together at all government levels and within the tourist industry. For this reason, we are removing COVID-19 restriction for fully vaccinated people today. I'd like to turn to Canadians. Our purpose in setting the table for the next summer season, the festival season, and vacations is ready.
They fall in love with our beautiful landscapes, vibrant cities, and cultural and historic treasures, and they want to come back for more. And I think of my recent visits, one to the Indigenous Peoples Experience in Fort Edmonton Park, and one on a guided tour of Stanley Park with Candice from Talais Tours. And these experiences can offer a glimpse into the rich diversity of First Nations, Inuit, and Métis culture from coast to coast to coast. Indigenous tourism is reconciliation in action. I think of how Canada has been named a top destination for LGBTQ2 travelers who are drawn in part because of Canada's hallmark safety and security. But there's more to it. We are an inclusive and caring society. I think about our strong appeal for those seeking a francophone language and cultural experience. Je pense également de notre fort attrait pour ceux qui recherchent une expérience linguistique et culturelle.
And for those who are looking for a francophone experience, here we are.
While you're focusing on kickstarting a comeback, the whole of our government is there, shoulder to shoulder with you. We will lead, we will engage, and we will inspire. I've said it on numerous occasions, safety first, then travel. With the changes announced today, I say to everyone around the world, make Canada your next trip. We have it all. Beautiful, breathtaking landscapes, internationally acclaimed festivals, premier national parks and outdoor recreation, diverse options from northern peaks to our downtown cores. And first and foremost, safety. Venez-vous-en, come experience it for yourself. Merci, thank you, hi. And now, moderator, over to you.
Oui, merci, merci, messieurs. Donc, on va prendre des questions.
Thank you. We'll take questions now.
5 minutes for questions. We have a hard stop at 11:30. Just a reminder to mute yourself between your question and your follow-up. So we will start with Kevin Gallagher, CTV News.
Good morning. My question's for Minister Duclos. Specifically when it comes to vaccine mandates for passengers on planes and trains. I mean, obviously, this is still in effect. I think the question really is, we know that through waning immunity and also the vaccine's effectiveness on the Omicron variant, that 2 shots is simply less effective and not nearly as effective as it was. So, the federal government, it seems, does have a choice now. Will the vaccine mandate remain for travelers on planes and trains, or will fully vaccinated, as a definition, have to incorporate 3 shots? So what decision do you think the federal government will make?
Well, thank you, Kevin. Those are very good questions, and let me answer in 3 different ways. First, as we noted, the announcement today is around pre-entry testing rules for vaccinated travelers. That doesn't impact the rules around unvaccinated travelers. Second, the vaccination rules for entering into Canada are rules that are decided in obviously based on the advice and the insights of public health officials. We're also working with international partners because obviously when planes travel in both directions, so we are working with international partners on establishing those rules, as you said, based on the what we know from an epidemiological perspective, but also from a virological perspective. So you are correct also in alluding to the fact that booster doses are there's a consensus that booster doses are needed. A 3-dose regime is a primary series regime that most experts agree to. And finally, I would point to the fact that that all obviously depends on the evolution of possible things on which we have little evidence and also certainly no control, which is the arrival of possible new variants or future waves. So all of this is based. All of these decisions today are based on the current measure of the situation, on prudence, on precaution, but also on the knowledge and the acknowledgement that these will continue to be addressed and possibly evolved.
So will you change the qualification for fully vaccinated? Does fully vaccinated, will that soon mean you need to have 3 doses? You need to have that booster shot. Is that going to meet the definition of fully vaccinated for the Canadian government?
A, there is no change to the definition of a fully vaccinated Canadian. B, you are correct in saying that we should keep encouraging Canadians to get a booster dose as a way to broaden and secure their protection against the virus. And C, it is true that in other countries they are contemplating that. If you look at France and Denmark, for instance, you'll see that a third dose is included in their definition of fully vaccinated people, but that's their decision, and we are making our own decisions in Canada.
Olivier Ferron-Boissy, TVA.
Bonjour.
Good morning.
Oui, donc, Monsieur Duclos.
Mr. Duclos.
On voit une certaine remontée des cas ailleurs.
We have seen a surge in cases, particularly in South Korea. We have seen climbing COVID cases in the provinces. Does that concern you at all? Are you going to contemplate introducing additional measures here in Canada? First of all, let's be clear, everyone has understood that COVID-19 is a virus that changes, so do the variants. And as we always say, and as we are saying today, the measures can evolve. The second thing is that in Canada, we are lucky that we have come through this much better than a lot of other countries. And it's important to remember also that here in Canada, we efficiently vaccinated millions of Canadians, and among those who were vaccinated twice, I think we have a rate of over 81%. And a lot of Canadians have got a booster dose as well. So we know, or we're hoping, that in a few weeks we will be protected individually and collectively. So nothing has been won yet with respect to COVID-19. COVID will continue to be with us for a very long time, but in Canada, we have come through it quite well now. And with our immunity rate in the country, I think that we will do very well over the next few weeks and months. We've heard that the WHO may not be purchasing the Quebec vaccine because of the Philip Morris incident. What do you think of that? What do you think of this opportunity? And what impact will this have on the management of vaccines in Canada? Will it have an impact on the COVAX? What do you think? Very well. So two very good things about Medicago. First of all, as everyone probably knows, this is a Canadian company, one of the rare Canadian companies that over the past few months have been able to develop and now produce a Canadian vaccine. We can all be very proud of this, given that we found out that during the start of COVID-19 that our pharmaceutical capacity had declined seriously over the past few years. The second good piece of news with respect to Medico is that it's a vaccine. It's the first Canadian vaccination that has been approved by Health Canada, but in addition, this is a vaccine that's used new technology, and this could be broadened to cover other types of diseases, and it will, and there's other vaccines that it would be involved as well. So this is a new technology that will complete the technology provided by other types of vaccines. Obviously, we're following this work, and we're following WHO closely. We're looking at the exchanges between WHO and Medico. Minister Champagne and I have contacted Medico to make sure that its contact with WHO is done properly, and so that everyone, not only here in Canada, but elsewhere in the world, can take advantage of this new vaccination that has been approved by Health Canada, and it can be good for a lot of other humans living elsewhere on the planet.
Ryan Tumulty, Post Media.
Yeah, hi there. This question's, I guess, probably for Dr. New. I wanted to ask, since we are, opening up to the world a little bit more here again, wondering if you can talk about improvements to sort of international disease surveillance that we might have made over the last 2 years. I'm thinking of GFIN, but more broadly, are we better positioned to be able to see outbreaks happening some other part of the world?
Thank you very much for the question. It's Dr. New, and yes, I can say that certainly there's been a lot of lessons learned over the past 2 years, and amongst them, obviously, in terms of continually improving, enhancing our surveillance systems, not just here at home, but also in terms of collaboration with partners around the world. As you can see, we're continually looking at what the experience has been in other countries in terms of their epidemic curves, what their experience has been with various variants, how their vaccine rollout has progressed, and how that's sort of affected their epidemic situation. Certainly, that's something I think we'll just continue to build on. So I would say that the short answer to your question is yes. I think overall surveillance systems across the world, but also the interconnectedness of surveillance systems certainly has improved over the past 2 years.
And then just following up on that, are you looking to set up a system maybe where we would examine specific countries and might invoke specific national travel bans in future if we saw? I know there's a couple places in the world that have seen particularly high COVID rates in the last few weeks.
That's a difficult question because certainly as we look at the data that comes out of the various countries, we recognize that, not all countries may have the capacity to be reporting as accurately compared to other countries. And we certainly don't want to, penalize specific countries for their ability to be able to report more rapidly. I think the recent experience with South Africa, and I think kudos again to them for being among the first to detect the Omicron variant, I think bears a sort of a lesson learned there in terms of how we could or should be reacting as the world. So I would say that I think we're all in it together. I think in terms of worldwide surveillance systems, and I think it's not really sort of aimed at picking out specific countries, but that we all need to be working together to strengthen or be able to detect new variants that come along, and then be able to, as you say, in a prudent fashion, react in the appropriate fashion across the world, and not, as you say, focus on specific countries.
Hélène Buzetti.
Oui, bonjour. Ma question est pour Monsieur Duclos.
My question is for Minister Duclos. Mr. Duclos, I'd like to go back to Kevin Gallagher's question. You said that the third dose was now part of the regular vaccine regime. So I'd like to know, what does it give to maintain this vaccination requirement at 2 doses when we know that it doesn't provide adequate coverages? 2 doses, we know it doesn't do that much. Thank you, Hélène. And I'd like to rectify something. 2 doses, it's much better than 0 doses. Yes, 2 doses doesn't protect perfectly against COVID-19, but there's no vaccine that protects people against disease 100%. So 2 doses does continue to afford good protection. It didn't do so well with the Omicron variant, but it does provide protection. I think 70% is the protection rate that now this is the rate that's used for determining the efficacy of vaccines for other diseases. So 2 doses does continue depending on the person, but it does continue to provide good protection. It also depends on the amount of time elapsed between the first and second dose, but it's not as good as a third dose, and that's why we're encouraging all those who are listening to us to go and get their booster dose if it hasn't already been done. But Minister Duclos, why maintain this vaccine obligation? And I'm talking here about travelers, obviously, but also federal public employees who have had to get a vaccination. I can see that these restrictions are dropping off in other provinces. do you have any intention to abandon this vaccine obligation? As I said earlier, all of the measures are subject to review, and we will continue to review these measures based on what we learn. We see that there's a waning off of efficacy. In time, we know that post-infection immunity accounts for something, and we think that there will be probably a new variant that will surface. We don't know how it will present itself, but all the measures will be reviewed. But the message I want to say, the main message I want to convey is 2 doses is better than nothing. And we need to have mandatory vaccination at present.
Dylan Robertson, Winnipeg Free Press.
Hi, thanks for taking our questions. A question for Minister Duclos about the reporting of COVID that you're expecting to keep in place. Manitoba has said that it will report COVID similar to influenza, which means news, weekly reports on hospitalizations and severity, but not the actual number of cases unless they end up in hospital. Does VAC have a plan for what types of data it will keep requesting from provinces, and what will Ottawa's reporting look like going forward?
Thank you, Dylan, for many different and good questions. I'll try to answer them as concisely and as fairly as possible. First, on provinces and territories, as we know, I think after 2 years of the pandemic, each province and each territory makes its own decisions based on the local context and the local public health advice. The second, you are correct in signaling the fact that we not only do we know less about COVID-19 than we would have, say, just a few months ago because of the lower availability of PCR testing. But we also know that this epidemiological situation will keep changing with new variants and new waves. So fewer tools using the traditional PCR molecular tests, but a continuing need to keep monitoring the situation. Fortunately, PHAC has made significant advances in the use, for instance, of wastewater data. I look forward to PHAC in the near future, reporting to you as journalists and possibly others on the usefulness, the key usefulness of that additional source of information on the epidemiology of COVID-19 in Canada. In addition to what you would have noted that when travelers enter Canada, there is a random selection of them. A PCR test is applied to them, so they go through a PCR test randomly, and that gives us information. Very, very, very strong and useful information on the size of the population that enters into Canada with different variants, where they come from. So it complements all of the other surveillance methods that Dr. New alluded to earlier. So I would say that different governments do different things. At the federal level, we are using further tools to keep monitoring and therefore fighting the virus.
Thank you. And for my follow-up, I just wanted to ask, I think the medical officers of health will have to discuss how they anticipate reporting going forward, but I'm just wondering, in terms of the types of material that we see come through the Flu Watch program, we're talking about the hospitalizations, we're talking about how many severe cases there are. At this point, do you have any sort of an indication of what we might actually want to expect, as these restrictions ease, in terms of what type of surveillance of the virus will continue over the coming months?
Well, for that great question, maybe we should turn to Dr. New. Dr. New, would you like to explain how PHAC is working in this new environment, connecting different types of data and to support the monitoring made by provinces and territories?
Yes, thank you very much for the question, Dylan. It's a Dr. New here, and you're right. We continue at the federal level, the Public Health Agency of Canada, working closely with our counterparts in the provinces and territories. And what we're looking towards is as you say, having a more of an integrated surveillance system. So it's a number of different initiatives. As Minister Duclos mentioned, certainly a very new and innovative tool is the wastewater surveillance, which can sometimes give us an early signal in terms of what a community might expect in terms of maybe a subsequent increase in actual number of cases of infection among its citizens. And then obviously as control measures are put in place, the wastewater surveillance is also a tool to be able to monitor the effectiveness of those control measures as hopefully, the sort of the indications or indicators of wastewater surveillance hopefully go down. So that's one initial new tool that we're also expanding right now. I think it's about 60% coverage across sort of municipalities and so on in Canada. We're hopefully trying to increase that to 80% and even more in the future. So that's one tool. With respect to the severity indicators, certainly we're expecting to continue receiving on a regular basis from the provinces and territories hospitalization data and other severity indicators, including deaths, to show us what might be happening with respect to let's say COVID-19 general, but obviously maybe the impact of a specific variant. And of course, besides the severity indicators, our ongoing monitoring in terms of actual infections continues with the provinces and territories. For example, as you pointed out, it may not necessarily be a case of having to detect every single case, but maybe more towards what we're doing for our flu surveillance, as you pointed out, having sentinel sites like flu watchers, looking at other indicators like maybe absenteeism rates, in schools and workplaces. And then, of course, it's important to continuously, on a regular basis, sample and actually do the genetic sequencing of individual cases to be able to monitor what might be happening with a shifting sort of mixture of variants in the country. And as the minister pointed out, on top of that, we'll have our border surveillance to be able to detect potentially the emergence of new variants around the world with respect to travelers coming into the country. So it is all encompassing, and there's lots of work underway, as they say, behind the scenes. Another thing I might mention is that we're also leveraging our existing Sentinel sites. For example, in hospitals, we have a Sentinel system with some key hospitals who are also able to give us some key data that we might need moving forward. So I think I'll leave it at that, and certainly happy to maybe get into more detail, maybe at a future presser that Dr. Tam and I will be giving.
Michel Sabat, la presse canadienne.
Oui, ma question est pour le
My
Dr.
question
New.
is for Dr.
S'agit-il
New.
d'une recommandation de la santé publique que les tests ne soient levés uniquement que
Is
pour
it
les
a
voyageurs
public
vaccinés à
health
2 doses?
recommendation that vaccinated people do not have to have these requirements anymore? Thank you very much for your question. With the policy that is currently in effect at the border, it's important as a principle too that we continue to comply with the policy on vaccinated travelers. We know that this is a very important tool. It's a key tool. And for travelers who arrive here in Canada and for the entire population. But if you want to look at the number of vaccinations, well, that gets interesting because we talk about being up to date with the vaccinations rather than looking at the number of doses of vaccination. For instance, we know that it's not just the number of vaccine doses that's important, but the interval between the doses, because we know that in some countries, people may have received 2, 3, or even 4 doses, but if the doses are not given at an interval like the one we have here in Canada, perhaps the immunity is not as robust as it may be here in Canada, because here we have an interval a longer interval between doses. 8 weeks is what the National Advisory Committee on Immunization recommended. And now we're talking about getting a booster 6 months later. Here in Canada, what's happening at the border is we know that a transition is occurring. There are a lot of travelers arriving here in Canada from other countries that are not as lucky as Canada. And we have to accept that other vaccinations recommended by the WHO. That's something that we're following. We're looking at the data. And so we continue to look at conclusive data, but for the instant, it's clear that Minister Duclos will continue to look at what's happening in other countries. We'll look at the data, and we will adjust our policy accordingly. Thank you. I heard what you had to say, but have you recommended the current 2-dose formula, or will you be calculating another type of formula? We know that with the number of vaccinations recommended in Canada, we know that in order to have a stronger protection, we know that after that immunity from a vaccination starts to decline after 6 months. So we have been talking about the need for booster doses for eligible people here in Canada. For those who have received their dose more than 6 months ago. But for travelers, there are other considerations that we have to take into account. To date, we accept 2 doses, but obviously we are going to look at the data, and we will take all of this data into account and provide our recommendations to the minister here in Canada. But for the time being, this is what the case is. So 10 minutes remaining.
Quite a few reporters that have questions, so just if we can keep our answers short, it would be great. Olivia Stefanovich, CBC.
Thank you. Good morning. You're making this announcement at a time when the WHO is warning about the spread of COVID-19, particularly the BA.2 variant worldwide. So I'm wondering, is this really the right time to be making these changes? And how prepared are you to roll these changes back if there is a spike in cases across the country?
Well, thank you, Olivia, for that great question. Well, as you will have heard, we will have seen over the last months, we keep following the situation and change and adjust the rules as required, taking into account both the domestic and the international situation. Over the last few weeks, just to give you perhaps some numbers, over the last few weeks, we've seen a significant decrease in the rates of positivity of travelers entering into Canada. That rate was almost 10% in January, which means that 1 out of 10 travelers in January entering into Canada was positive with COVID. That was significantly larger, obviously, than what we had seen in early in December and prior to that. That rate has fallen to about 1% now. So, no, there is obviously alignment between that rate and what we see internally in Canada and outside of Canada. This being said, you are entirely correct. In the world, according to the WHO, there is an increase in the overall global number of cases, most importantly in some regions of Asia and some parts of Europe. So we are going to keep monitoring the situation. As Dr. New mentioned earlier, we are going to use MRT, mandatory random testing, to do that on a region, country-specific basis. And if we see that we need to adjust measures, we will obviously do that because, as Randy and Omar also mentioned, we are mindful of the importance of focusing on the health and safety of everyone.
How much longer do you expect travelers to be required to wear masks on planes and trains?
Maybe I should turn to Minister Alghabra for that question.
Thank you, Jean-Yves. So, look, we'll continue to rely on the advice that we receive from our public health, and we will adjust our measures as the situation evolves. But we're also, just like we will ease our measures if things appear to be evolving in a negative direction, we will also have to adjust our measures accordingly. So we just need to be nimble, maintaining that we're protecting the public health and safety of Canadians.
And I agree, obviously. And Omar, maybe Minister Alghabra, I should have pointed to Dr. New as well, because wearing a mask is something that comes with obviously some inconvenience. Individually, we'd all prefer not to wear a mask for all sorts of obvious reasons. But the health benefits of wearing a mask, particularly in crowded areas like a plane or a train, that are also well known. So I'm going to turn back to you, Guillaume, because I know time is too short.
This is Dr. New. I was just going to mention, just from a public health perspective, certainly the use of face masks is a personal protective measure. It's another layer of protection that we certainly would recommend, and certainly in the context of being, as Minister Duclos and Mr. Alghabra said, if you're in an enclosed space, like say an airplane, for an extended period of time, I think it just makes sense that we've always talked about avoiding the 3 C's, or at least being careful what you do in the 3 C's. You have crowded, closed spaces with close contact. So I think at a personal level, I would certainly think, it doesn't matter if there's a mandate or not. I think it's just a good practice to keep wearing a face mask in certain contexts. Thank you.
Raphaël Pirot, Agence QUIVI.
Good morning. My question is for Minister Alghabra. I'd like to understand the process when the Belarusian or Russian planes cross Canadian skies. Could you provide some clarification? What is the process? And is it the Department of Transport that manages the situation, or is it now in the hands of the Minister of Defense?
Thank you for the question. Look, from the beginning, we've been outlining comprehensive measures to respond to the unprovoked attack by Russia on Ukraine. And we've expressed our solidarity with Ukraine and the Ukrainian people in this moment of need. Part of our measures have been back to ban Russian flights from Canadian airspace and Russian boats from Canadian waters. And we've now accelerated or expanded these measures to include Belarusian planes. So this NOTAM, it's done under a NOTAM, Notice to Airmen mechanism, where we issue an advice or a warning to air operators that if they are part of those measures, they must avoid Canadian airspace. And NAV Canada, the air traffic control body, is responsible for enforcing that. So so operators and pilots are notified before getting close to Canadian airspace that if there are a Russian-owned or chartered plane, or if there are Belarusian-owned or chartered plane, they are not allowed to enter Canadian airspace.
Okay, merci.
Thank you. Mr. Duclos, earlier We talked about what it means to be adequately vaccinated. Foreigners who are not vaccinated with Canadian-approved vaccinations are not considered as being fully vaccinated. Is that something that you are going to change eventually? And do we know how many people cannot enter Canada because of that reason? Thank you, Mr. Pirot. There are a few exceptions, which I'm not going to enumerate because I'm sure to miss a few, but there are exemptions for foreign temporary workers. A small percentage of them are not vaccinated, but they can enter Canada, providing they quarantine for 14 days. But generally speaking, you're quite right. You have to be vaccinated to come into Canada as a general rule. A lot of countries, a lot of people who want to visit us, and they have high vaccination rates. Sometimes even they come from countries with a higher vaccinate rate than Canada. So the fact that so very few people are excluded. We have time for one final question.
Since we have a few people still with their hands up, maybe you guys can share a question and a follow-up. So we would go to Valérie Gamache and then maybe Global News. Go ahead.
Oui, bonjour, vous m'entendez?
Can you hear me?
Bonjour, vous m'entendez?
You can hear me? Yes, I can hear you. I'd like to go back to Minister Duclos about Medicago. What impact will this have on COVAX? And what impact will it have with respect to WHO? First of all, perhaps I didn't say it clearly enough, but the decision made by WHO has not been taken yet, and we want to ensure with Medicago that the information is shared between the two organizations. All of this is underway, and what I did say, and I'm happy to repeat this, Medicago is good for Canada and Canadians, but it's also good for other countries because this is the unique type of technology, and it will strengthen the range of technologies used to produce vaccinations throughout the world. It's a really good piece of news that this is a Canadian company, and it will really do a lot for our pharmaceutical sector, and it's very good for the future in vaccinating people against COVID. I do understand, but WHO has clear rules. It says that cigarettes are the biggest killers of the world, but getting vaccinations that are being paid for by cigarette producers, are you trying to get around the rules? So what's the story there? We are ensuring that WHO has all the information that Medico has, and also the Health Canada is one of the regulatory bodies in the world that has a very solid reputation. So if Health Canada approves a vaccination, that will really help the vaccination get approved elsewhere. So Health Canada's approval is sending a very clear signal, and so WHO will have to look at this information and all other available information in order to make a decision.
Apparently, this is all the time that we have. I'm sorry that for the reporters that are still on the line. Thank you, ministers. Merci beaucoup tout le monde. Je vous souhaite une excellente journée.